Hello, my name is John Burris, and I'm the owner of a Little Wellness Company. I'm a fascia body worker, yoga therapist, and also a body-mind therapist. I want to share with you some important information that I've learned over the last 40 years or so. This video is called The Perils and Pitfalls of Physical Therapy. What I want to do is share with you some of the narratives or false narratives that happen in healing. And we'll go deeper into those different perspectives. So imagine you were in a car crash and you're given a prescription for physical therapy for weeks or months, and you go through 3, 4, 5 times a week. And after that period, you don't feel any better, or sometimes you feel worse and you're perhaps feeling perplexed or just not knowing what's going on. Well, there's some better questions we need to ask when going through physical therapy. So in this video, I'll expose some of the dirty little secrets of the physical therapy industry and maybe help you make better choices in your healing. So not to bash an entire industry, there's some really good physical therapists out there doing some really good treatments. Some of the treatments are really very helpful. And on the other hand, there's some really bad treatments that don't work at all or actually very much can hurt the body. So we're going to expose some of those and share with you ideas to help you in your healing along your journey. In my experience, physical therapy often has a very limited success rate. It's more of a compensation model than a healing model. What I mean by that is it tends to put muscle on top of an injury and never really get the injury out. So often people feel lack of movement, lack of sensation, and pain remains after months and months of therapy, and they're still confused about why. So we will explore here why some of the techniques don't work very well and why a compensation model isn't necessarily the best model to be using in order to heal the body. Physical therapy is the offshoot of the Western medical mechanistic system of healing. In that system, the original site of the injury or complaint is addressed, and this is not necessarily anything else around it. So what I'm going to share with you today is more of a holistic way of looking at the body and a holistic way of looking at things rather than just looking at where you might be experiencing pain or discomfort and trying to grasp where your injury or your pain might be actually coming from. And that way you'll have a better chance of healing. I've outlined 7 particular areas that need to be addressed, and once we can examine those areas, you'll get a better idea of what questions you should be asking and what treatments you should be seeking out. So let's start with number 1 on the list. So the first issue with physical therapy is that when you walk into the average physical therapist's office, what you see is a gym, a fitness center. So the rule of thumb is we're going to create more fitness in order to be healthy. So there are a couple problems with that. First of all, there's an assumption that all injuries are because you have weak muscles. That's not always true. Fitness is not always the pathway to health. So when you see workout equipment is the first thing you see in a physical therapy office, it should alarm you because that's not always the best way to heal an injury or recover for something. So a gym and a physical therapist's office seems a little crazy to me. Second reason is it's a business model more than a healing model. If a physical therapist can put several people on different gym equipment and not touch them or have hands-on experience with them, they can bill the insurance company multiple times over and never actually touch the person. So being a gym, people can go in and work out themselves, given a routine by a physical therapist. The insurance company gets billed for multiple people working out. So it's not always the best model to follow. So let me demonstrate to you this fitness model, the health model, which I don't agree with. So imagine you have a knee issue or hip issue and you have a pain and discomfort and lack of mobility. Well, you're taught to strengthen the muscles and strengthen all the tissues. Well, here's the problem with that. So let's say you have a knee issue and your knee is imbalanced, because most issues are about imbalance. And so you have a system that basically is out of alignment, as we yoga teachers would call it. So The physical therapy model says, well, let's just put muscle on top of this imbalance. And that never works because you might have the pain go away temporarily, but it's always going to be imbalanced. It's always going to act out for the rest of your life. So the model is like if you have a pillar in your house or a building, and there's an earthquake and it starts to shift and it starts to crack and it starts to become imbalanced, like this model here. This would be like taking some strong tape and then taping it up and saying, oh, I fixed it. It's all fixed. Well, that's what the fitness model in physical therapy does. It puts muscle around injuries, and it doesn't necessarily correct the injury. You're still going to have the imbalance. Now you have more muscle on top of that, and they call that healing. Well, I tend to disagree with that, because most people, their problems show up weeks, months, years later because they never correct the imbalance when you first go into a physical therapy office and you're introduced to a gym or a fitness center. That doesn't work. Now, if you do use strength training as one of your tools in healing, always remember that muscle comes last, not first. When you try to make muscle come first, it's a disservice to your own body, and you're never really going to heal anyways. So remember that muscle comes last, not first. The second point to consider is that the physical therapy model is a mechanistic model, and it's opposed to the holistic model. So physical therapy works on mechanism. Let me explain what that means. The mechanistic model looks at the site of the injury or the pain. It doesn't necessarily look outside of that. For example, I had 35 years of sciatica, and I was taught that I had a back problem, and I learned later on I had a foot and ankle problem causing a spiral in my leg. So the mechanistic model is just very focused on where you feel pain and discomfort and doesn't necessarily look outside of that box. So it sincerely limits you in what you can do to discover a new possibility. So let me show you on a larger model how that might work for you. As you can see by this larger model here, there's a makeup of your body here. Let's say you have a hip problem. In your hip, you have pain, you have maybe deterioration in the hip socket, and you're diagnosed with a hip problem or needing a surgery or whatnot. Well, the holistic model looks at the entire body. The mechanistic model looks just at the hip. For example, most people that I've ever worked with hip issues have leg issues. For example, if you had a sprained ankle when you were younger, perhaps 10 years old, and you never got corrected, then it's going to pull into your knee, and it's going to shift into your hips. And now you're going to have a hip issue because all these fascia and muscle lines will pull to the body. It could end up in your lower back. It could end up in your neck. As your hips twist and turn, a lot of that's coming from someplace else. And your hip issue, pain in the hip, looked at mechanistically, is not going to solve the rest of your issues here. So this is the difference between the mechanistic model and the holistic model. The holistic model looks at the entire body, and the mechanistic model, which physical therapy is based on, only looks at the site of the injury. That's where you're going to be severely limited many times because you're not going to correct the problem. You're going to compensate for it. The next false premise about physical therapy, there's a belief that states that a hard body is a healthy body. Well, my nearly 40 years of working on bodies, either teaching yoga or doing hands-on body work, I've never felt hard bodies to be healthy at all. A hard body is a dried out, beef jerky-like tissues that lack vitality, lack movement, lack circulation. Essentially, it's drying out and dead. There's an expression that goes, we are born as a grape and we die as a raisin. When you practice a hard body concept, you're creating more of a raisin-like body in you, and you're killing your tissues. So this whole notion we need to harden our bodies to heal is a false narrative. I've never seen it in any of my practices. So you want to start looking at why I need to keep adding hardness to my body in order to get well. And that's a false mistake that physical therapists are making as well. Hardness is not health. It's a war model based on war. It was started hundreds and hundreds of years ago that warriors needed to harden their body to be better warriors. Well, we're still practicing it, and we're practicing it in our healing environments as well. Hardness is not health, and the physical therapy model is based on a war model of hardness. Another one of the false premises of physical therapy, it's very much technology-driven, machine-driven, robot-driven. And yes, there are some good machines and devices and technology that can be very helpful. Unfortunately, it's a prominent way that technicians are used to heal the body. We're taught to be healed by machines rather than hands-on. In my experience, the best treatment for physical therapy is hands-on treatment. Massage, craniosacral therapy, fascia body work, movement therapy, where a technician's actually working on you for an entire hour or so, one-on-one. Instead of being placed on a TENS unit or another machine or doing your own fitness routine where the insurance company is being billed. So I always prefer hands-on treatment by a skilled technician, a skilled therapist. To me, that's the best type of treatment anybody could ever have. While machine-driven healing can be helpful, I do not believe it should be the primary treatment choice in a physical therapy office. But once again, it's a business model where if I can hook up several patients to a machine and just walk away, I make more money that way. If I have to hire skilled technicians to work on a patient one-on-one for an hour, you're not going to make as much money. So sometimes it's about the money. Follow the money trail. The next factor in physical therapy is that the fascia and the connective tissue of the human body are almost always ignored or at least disrespected. So what is fascia? Fascia is the wrappings around the muscle. It's a white fibrate substance that contains everything. It's the largest organ in the human body. Let me show you a picture of how that works. Fascia could be like the white fibers in an orange, where the orange fibers and the orange juice would be considered the muscle, and the white fibers would be considered the fascia. The fiber is the binding material that essentially keeps everything together. Most people's injuries have at least some or all to do with the fascia and not the muscles themselves. But in the physical therapy realm, fascia is almost always ignored. It should be the first thing that's addressed, and most likely it's not. We live in a muscle-driven, actually muscle-obsessed culture where everything is muscle. And we don't pay any attention to the fascia in the body. Our bodies were designed to be soft and pliable and flexible as well as strong. And we're ignoring that aspect. So some of the best physical therapy doesn't come from physical therapists. It comes from yoga teachers and fascia body workers and massage therapists who create a soft, flexible, pliable body rather than a hard body. So in order to heal your body, most people need to pay more attention to their fascia and less attention to their muscles, because it's not necessarily the muscle causing the problem. It's the fascia that needs to be lengthened, softened, and released. That's not necessarily happening in the normal physical therapy office. Another interesting idea to consider is called energy cyst. Physical therapy doesn't necessarily address these. Let me show you how that works. Imagine you were in a skiing accident and you fell on your shoulder, and it hurts and there's pain and there's discomfort and lack of mobility. Well, impact trauma does a couple of things. You may have landed directly in this bullseye here, but that energy spreads out down your arm, in your chest, in your neck, in the back of your shoulder. It all spreads out. It's not localized in one way. It's more or less like a paintball splatter. And I'll show you a picture of that. So we have an injury. We have a bullseye right in the middle where we're impacted directly, but the energy of the injury scatters all out like a paintball splatter. So you may have it wrap around your shoulder, up into your neck, down your arm or leg. You may have residual pain in other places. Physical therapy doesn't necessarily address the splattering of the energy in a trauma, whether it's a skiing accident, car crash, any other types of injury. They don't address that. So as the energy of impact splatters throughout the body, a lot of it goes unaddressed and it shows up later down the road. Many people have whiplashes 15, 20 years later, they feel the pain because it got buried and is splattered around the neck. So we'd have to ask, why don't physical therapists address these splatterings of energy cysts? Well, partly they can't because it's an insurance billing code. If you get a prescription from a medical doctor for a shoulder treatment, you're only allowed to work on the shoulder. You're not allowed to work on the neck, the arm, the chest, or the back because the insurance code specifies a specific area that has to be worked on. So that's how the mechanistic system works. It won't allow you to practice holistic medicine. The next part is how the physical therapy model ignores emotions altogether. Most injuries also have an emotional component to them. For example, I've worked on this business for over 40 years. I'll be working on somebody's neck or shoulder and they start sobbing, sometimes for minutes, sometimes for hours. And the memories start coming up of their childhood or the trauma stuck in their bodies. The tissues of our bodies hold emotions and memories and stories. Well, the physical therapy model does very little to nothing to address that. Sometimes releasing the memories and the energy and the stories in the body become the best way to heal. So the physical therapy model is more of a physical model, and it totally ignores the emotional body and how emotions are stored in the tissues, especially after a trauma or something that is very frightening for the body. And the last part to consider is called pain management. Just because your pain is gone doesn't mean your condition has been healed. You might be in a compensation mode and the pain will resurface later on because you haven't necessarily corrected the problem. So pain being gone is not success. It might mean something else. Remember that pain is just a messenger. Just because you've eliminated pain doesn't mean you've cured your body. A lot of the techniques in the physical therapy realm are designed to manage your pain or to numb it out. A numb body isn't necessarily a healed body. The issue still continues and it will resurface later on. So I hope that answers some important questions you might have about why your physical therapy treatments haven't been very successful. And if you had great success, that's wonderful. Once again, there are wonderful treatments out there and wonderful therapists. And again, many people are disillusioned because they don't ask the right questions about what this is doing. So thank you for watching. I hope this informed you about how I see therapy and healing. If you'd like to learn more about me, visit my website at johnburris.com or subscribe to my channel here for more leading edge videos to come. Thank you.